I'm Marek Trněný. I'm the head of the first department of medicine, Charles University General Hospital in Prague. My field of interest are lymphomas and the CLL. We are here at ASH in Orlando, and just today I had a privilege in the oral session to discuss the treatment for the elderly patient with a relapsed refractory indolent lymphoma treated within the AUGMENT study. The AUGMENT study, which has been published in the spring this year, was focused on the relapsed refractory indolent lymphoma. Patients were randomized into two arms, experimental arm R square, lenalidomide plus rituximab, and the comparator arm was rituximab monotherapy. And just today I have been focused on the elderly population, so it means that we perform post-hoc analysis of the patient at the age 70 plus. Median age of those patients were 75. There was a 91 of those patients, 47 R square, 44 are rituximab. And the question is if the positive outcome, if the benefit of the R square is held in this subgroup as well. And we have shown that there is a trend for the better progression-free survival. And very importantly, when we focused on the follicular lymphoma only, there is still significant benefit in terms of the progression-free survival. The hazard ratio was 0.49. It was statistically significant. The median progression-free survival was 28 versus 14 months. It was translated to the trend in the follicular lymphoma to the longer time to the next treatment. There was no difference in terms of the overall survival. But the very important point is that the treatment was feasible, was manageable. So definitely there is no additional or some other hints compared to the general population. So it means that the major adverse effects are hematologic adverse effect, leukopenia, neutropenia, but we have observed no death in the experimental arm due to the adverse event. There was one death in the rituximab plus placebo arm because of pneumonia. And at least our conclusion is that we can consider this type of the treatment as a feasible and the treatment which could bring benefit to the patients who are older, with the median age 75, the range 70 to 88.